So my name is Maxwell. I'm a doctor, a registrar in microbiology and infectious diseases. And I brought a poster today looking at our antimicrobial stewardship rounds. So these are rounds done in the acute medical ward in Cardiff with consultant microbiologists, registrars like myself, pharmacists and also biomedical scientists. And the role of these ward rounds was to try and promote switching patients largely from IV to oral antibiotics, ensuring they're on the correct antibiotics. What I looked at from our data was whether, in particular, stopping the antibiotics or these oral switches led to any adverse patient outcomes, which happily they didn't. And the majority of patients that we reviewed were able to either be switched to oral antibiotics or have their antibiotics stopped entirely, which promoted early discharge, which is obviously better for patients and better for the hospital. Hospitals do have these antimicrobial stewardship ward rounds, but it was the first time it's been set up in our hospital. And looking at the data, it's been very encouraging that we are making a difference and changing the antibiotics that patients are on. So sometimes actually the antibiotics have to be escalated, so more broad spectrum antibiotic. But as I said, most of the time they can either be switched to orals or stopped entirely, which is better for the patients. And I think there's a lot of evidence that antimicrobial stewardship is really important at the moment, particularly with overuse of broad spectrum antibiotics in the acute setting, and the sort of problems with current antimicrobial resistance generally. It's been really positive actually. We did do some surveys, which weren't included in the poster actually, and the doctors on the ward have had really positive feedback that they feel more confident in switching from IV to oral antibiotics, that they enjoy having the stewardship ward rounds. It's also reduced the call volume to our microbiology hub, which is sort of where the doctors on the wards will call for advice, so that's been another benefit. So sort of saving the time spent doing the antimicrobial stewardship has then saved time in terms of responding to calls from the ward. And as well as the doctors, we actually asked the nursing staff what they thought, and for them, switching from IV to oral antibiotics is a massive reduction in their workload, because obviously drawing up IVs, checking them, is quite time-consuming part of their day.